Hey everybody, Jeremy Stidham here, Coleman Internal Medicine. I'm a practicing internist. I work with the Good Samaritan Clinic, and I've been asked to make a video talking about the vaccine administrations that are going to be available to everybody in the very near future here. I'm hoping that this will be useful for everyone, especially at the Good Samaritan Clinic, but if you find your way to this video through some other channel, I hope you enjoy it, find it useful. This won't take long. I'm going to go through some of the key topics, the things that I frequently get asked, and hopefully we can help everybody understand the vaccine better and understand the benefits of getting it. So we're just going to start with what are the benefits of getting the COVID-19 vaccine, and the most obvious is decreasing your likelihood of getting it. So many people that I've known over the past year or so have had a lot of difficulty, even in young and healthy folks. So I'm encouraging everybody to get vaccinated to avoid all the potential complications that I've had to deal with in the past year for these folks. The other benefit of getting the vaccine is not only does it decrease your chance of getting it, but it also decreases everybody else's chance of getting it by herd immunity. And you've probably heard about herd immunity. Once enough people in our community have been vaccinated, then the likelihood of anyone who has not been vaccinated of getting the illness is significantly lower, just because the burden of illness in our community is going to be significantly less. So getting the vaccine is not only good for you, but it's good for everybody else in our community. Can the virus be contracted through the vaccine? I've had people wonder if getting the shot will cause them to get the illness. And the answer is no. The vaccines that are available do not use the live COVID-19 virus in them, which makes them very safe from the standpoint of getting COVID-19. I have seen people get COVID-19 after their first vaccine and before their second vaccine. But it is not because they got the vaccine, it's because they unfortunately came in contact with the virus before their own body's immunity was able to be built. So no, you don't get the virus from the vaccine itself. What are the possible side effects of the vaccine? And there certainly are the potential for side effects from any medication. The vaccine is no exception. And my experience with it was that the first shot made my arm a little sore, and the second shot gave me some body aches and some chills for 3 or 4 hours that evening. And that's the norm that I hear from folks who had some sort of after effects from the vaccine, is that it was a very limited and mild course of it. You know, the producers will tell you that the potential side effects include fevers, chills, body aches, headaches, and that these can go on for 1 to 2 days thereafter. It would certainly be an uncommon situation to have any sort of prolonged side effects from this vaccine. And so far in my practice, the only side effect that people have told me about that's lasted more than a day or two was fatigue. But having said that, it's been a very well tolerated medication, vaccine, and you should not worry about long-term side effects from this, given the fact that this mRNA technology is not a brand new thing. Many people out there are concerned that the potential for long-term side effects exists, and I can't say that they don't. But the likelihood of any vaccine giving us long-term sequelae is very, very low, especially given the history of vaccinations over the past several decades during my career here. Please don't worry that the mRNA technology is new. It is not. The vaccine is new. So can I guarantee with 100% certainty that no one will have long-term consequences? Obviously not, but the likelihood is very, very low. And given the potential severity of developing illness from COVID-19, I definitely will take a vaccine and have already. Is it okay to take over-the-counter pain medicines before or after getting the vaccine? And the short answer is probably. If you take pain medications after getting the vaccine, that is a well-accepted practice. Things like Tylenol and ibuprofen, assuming you have no other medical conditions that would prevent you from using those medications, seem to be very well tolerated and effective after getting the vaccine. Having said that, I encourage people not to use those type of medications before getting the vaccine, because the vaccine was not studied in that manner. And we do not know what the potential is for those type medications to affect the effectiveness of the vaccine. So after you get the vaccine, feel free to use some Tylenol, get rid of some of the sore arm, but I would avoid their use prior to the vaccine administration. Can you get the vaccine if you have other existing health conditions? And the answer is emphatically yes. In fact, you are more in need of the vaccine if you have other health conditions: asthma, diabetes, heart disease, lung disease, a number of other confounding issues that may make you more susceptible to severe illness from the disease itself should you contract it. So please don't consider other health conditions as a hindrance to your ability to get the vaccine. I would definitely consider them as an instigator to get the vaccine itself. Can pregnant and breastfeeding women get the COVID-19 vaccine? The shorter answer is you are allowed to. However, the vaccine has not been studied in pregnant or breastfeeding women. I would certainly ask your OBGYN provider if they have strong feelings one way or another about this. It has been given to those in that group, but I can tell you that it has not been studied and there's no significant data reported yet about its safety in that population. Is there anyone who should not get the vaccine? Two people that currently should not get the vaccine. One is if you are under the age of 16. It was not studied in that population. However, studies are ongoing for younger folks. So more news to come on that. And the other population would be people who are allergic to it. And there have been some allergies to it, just as there are to any other medication out there. And these allergies are going to be, typical skin rashes and things like that. So if you had side effects from the vaccine that were due to an allergy on your first shot, then you should probably avoid getting the second shot of that same type. Should you get the vaccine if you've already had COVID-19? And yes, you should. The body's own immune system builds its own antibodies against the virus after having been exposed to it, but we don't know how long those antibodies last or how effective they will be against other strains of the virus that you may contact down the road. The vaccine that is currently available still does work against all the potential strains that are available or out there after us. So I would go ahead and get the vaccine even if you've had COVID-19 already. The caveat is waiting about 90 days after your diagnosis to get the vaccine. Can you stop taking safety precautions after getting the vaccine? And it's a little bit of a moving target right now. You'll notice that I'm not wearing a mask, but I'm sitting in a room by myself talking to a cell phone. The short answer to that is if you are fully vaccinated, which I'll tell you more about in a second, and you are interacting with someone else who is also fully vaccinated, that should be a safe procedure. You don't know who's fully vaccinated out there for the most part, so if you're going to be in public places, then pretend that everybody else in the room is not. And that means you wear a mask not only to protect yourself, but to protect others from you, because you could still be a carrier of the virus and asymptomatic given the fact that you've been vaccinated. What does fully vaccinated mean, though? And that means at least 2 weeks after your final dose of the vaccine. So if you do a 2-shot series, you're going to have your first shot. Several weeks later, you'll have the second. 2 weeks after that, you can consider yourself fully vaccinated, at which point the only change for you as far as safety precautions would be the allowance of interacting with others who are also fully vaccinated and unmasked at that point. So that's everything I've got on the vaccine. I hope this has given you some thought or at least some concern, and want you to go out and find the vaccine. It's going to be available. It's going to be available soon. It's going to be available for everybody 16 and older and potentially even younger down the road. It's been well tolerated and extremely effective. So I appreciate your time on this. Y'all have a good one.